I'd like to welcome Minister White to the House. Senator Kelly, 4 minutes.
Thank you, Chairman. I also want to welcome Minister White to the House. Minister, as you know, prior to the last election, the issue of Roscommon Hospital and Roscommon A&E was hot on the agenda in the county of Roscommon. And prior to the election, there was promises given by the Minister for Health that the A&E department would be retained under his watch. And I think everybody in the county bought into that. And anyone that might have considered maybe supporting me at the time decided, well, the incumbent Minister for Health wasn't going to let them down, so they supported Fine Gael. Now, subsequent to that, as you're well aware, there was the consultants in Roscommon were kind of worried that they were kind of short of staff to make or to ensure that the A&E was operating, fully within health and safety guidelines. So they wrote to the Minister for Health or to the Department of Health just to inform them that they needed extra resources. At that point, HICWA got wind of it, and HICWA just, without ever calling to Roscommon Hospital, shut down the A&E department on the grounds that they were more or less implying that the consultant said it was an unsafe place to work. Now, in light of what we have subsequently seen in the last couple of weeks, that has reopened the whole debate on the A&E department in Roscommon Hospital in relation to the hospital in Kilkenny and the extra funding for the A&E in Wexford, the people of Roscommon now quite rightly feel aggrieved, because they now see that instead of HICWA coming in and shutting down an A&E department, they could have actually invested in it to ensure that it was up to the standards required. And bear in mind, the Accident and Emergency Department in Roscommon County Hospital had an investment of something like 17 million in recent years. So it is state of the art. All that was lacking was support staff that the consultants were looking for. Prior to that as well, I had got a commitment from the former CEO of the HSE, Professor Drum, that the A&E in Roscommon Hospital would not be closed, albeit it was under threat with the previous administration. There was no question at all about this. This is a HSE agenda that Fianna Fáil were going to play ball with anyway. But I had a commitment got from Professor Drum that the doors of the A&E would not close until the advanced paramedics were up and running and proven for a period of 6 months to the people of Roscommon that it was every bit as good, if not better, of a service than an A&E department. And that was another promise that was reneged on. Now, I've always said, Minister, that HICWA were set up by the HSE to be basically their chopping block. And I have nothing other than that to go on. Anything that they have done to date has proved that to me. Because in recent times, the question was asked of HICWA, what if lots and lots of HSE staff on the front line take early retirement and put pressure on the services? Is there not a health and safety issue there for them? And the answer is that they have no role in staffing. But they had a bloody role in staffing when it came to Roscommon A&E. So they had. They said because the staffing wasn't there, that it was time to close down the department. Now, what I'm asking, Minister, and I would like if you'd relay this back to the Minister Riley, and that is that at this late stage, that the Minister consider putting in a stabilisation unit in Roscommon Hospital in the A&E department, that people in the area that have heart attacks or strokes or accidents can be dealt with, stabilised, and then moved on to an appropriate hospital. But at least to have something, behind those doors that people will feel safe at night as a result of something unforeseen, and knowing that, the people really do feel let down at this stage.